Okay, good morning. I'm Edward Ng. I'm Director of IT over at the Pittsburgh Foundation. Thanks for joining us for our monthly COVID response call. Just a couple items. First, we are recording these sessions and we'll make them available for upload or download after the webinar. If you would put all of your questions in the question box, and we will try to answer those for you after the webinar via email. And that is about it. So there's also a survey going out after this. Please take the time to complete that survey. We'd really appreciate it. And then finally, I'll hand it over to Alyssa.
Great. Thank you, Edward, and good morning, everyone. McCrae was on the call for a minute and then got knocked off. So we're hoping that she can get back on so that she can also do a greeting and then tell us about the painting, which I think is quite lovely, but I don't have the background information that McCrae has. So it is courtesy of our great partners, Westmoreland Museum of American Art. And if you haven't been there, please go and check out their collection. It's wonderful. So I am Alyssa Chelodowski. I'm the Westmoreland Region Director for United Way of Southwestern Pennsylvania, and this is our monthly COVID call. We have been doing these calls for about a year and a half, maybe close to 2 years, as we've worked our way through the pandemic and then hopefully out towards the other end of it. I generally like to give a little bit of a recap about United Way's 211 messages and calls that we've gotten, and I took a quick look at the data this morning. The last 30 days, there have been almost 1,000 calls to 211, 987 to be exact, for those who like the exact numbers. 48% of those calls were around housing, and 85% of the housing calls were about rental assistance. So we're still seeing quite a need in our community for individuals who are reaching out for help around paying their rent and getting help. There's also been a number of calls around shelter, and I know Deb Thackrich is on the call as well as Dan Carney, and they'll definitely be talking more about some of the housing needs that we see in the community. So those are still, people are still reaching out, looking for help, and 211 is able to provide great resources. The other calls generally have been coming in around food and utility help. So again, indicating that people are still struggling, although those calls have gone down a little bit through the past couple months, but still going steady at about that 1,000 calls a month. And I have a little bit of announcement in a personal note. I am going to be moving to a new position within the United Way of Southwestern Pennsylvania, which I'm very excited about. It's Chief Program and Policy Officer. I will be based in our Pittsburgh office, and in this role, leading our community impact and advocacy efforts across the region around our new pillars that we've been talking about: meeting basic needs, moving to financial stability, and building on success in school and life. And then I'll also have primarily responsibility to lead the 211 efforts and its growth. So super excited about that, although I am a little bit bittersweet and sad to leave all my colleagues and friends in Westmoreland County. It's been a wonderful 8 years that I've been with United Way based in the Greensburg office. So I'm not leaving the community. I'll still be talking regularly with the team in Greensburg, and I just wanted to let this group know how meaningful these calls have been, and working with this great group and the providers and information that we have shared. I think this has just been a real shining light in this time of a little bit of a darkness for people, just to have this connection to one another and the referrals and the information that we share here. I want to say a special thank you to Edward and to Allison, because like me, they have been with this from the start. We began, it was Dirk Mattson, Phil Koch, and I kind of rallying the troops with this. And Dirk retired. Phil also has gone to Pittsburgh for a position with the Pittsburgh Foundation there. But Allison and Edward have been with us and helped us keep this going. And I know with McCrae on board now, in great hands, and we will have an interim director in the Westmoreland region. Her name is Amy Franz. She's our Butler Region Director for United Way, so she'll be for at least 90 days kind of splitting her time between the two offices as we sort out what's next in that role, but definitely continue to be committed to the Westmoreland and Fayette County region for United Way, so there will be somebody in that position, so rest assured. it's very important to our work. So with all of that news, I will turn it back over to McCray. McCray, I said how lovely the painting was, but that you had the information about it. Thank you.
Okay, so for folks that are interested, it is artwork by Ernest Fine, well known for his New York cityscapes and harbor scenes. He concentrated on industry as a subject in the winter of 1935 to 1936, when he made a sketching trip through the steel and coal mining areas of Pennsylvania and West Virginia. From coal breakers to blast furnaces, he recorded the industrial environment in simplified compositions that focus on the subject at hand. Painted in a precisionist style, Coal Breaker calls attention to the angular geometry of the building itself in a pristine winter landscape. So thank you. And thank you, Alyssa, for kicking us off. I apologize. We're having a little bit of network problems here at home. So first, I really want to thank Alyssa for welcoming me into this role and these calls, and being such a great partner and help and guide over the last 9 months. So I'm really going to miss her, but she will still be with United Way, so sure we can all still reach out to her. As far as CFWC, just a couple of updates. We are going to be releasing our Revitalizing Westmoreland RFP later this month, and that is the RFP that's focused on community development across the county, so please keep your eyes open for that. We also will have a Westco Nonprofit Network event this week on the state of nonprofits in PA, so please please register. If you haven't received an invite and would like to, you can reach out to myself or Allison, and we can get you the information. So we're gonna jump in now with Commissioner Cerulli Thrasher. Is she on the call?
Yes, I am. Can you guys hear me?
Yes, perfect.
Great. Well, first I want to say, Alyssa, congratulations. It's great news, well deserved. We're sad to see you leave Westmoreland, but it's always great to have somebody with a Westmoreland voice at the regional level. So you'll still be working with us, so thank you. Also, I'm sure everyone saw the news today. My colleague, Commissioner Doug Chu, tested positive for COVID again. He is doing okay, just very congested and very, very exhausted. So he's not going to be able to join the call with us today. He is on medicine though, so hopefully their symptoms remain mild. Just want to do 2 quick updates. Thanks to Dan Carney, Union Mission, and also to Alyssa and United Way for helping us with the rental assistance. We are receiving more money, and I know United Way is going to be helping with marketing to really try to get this information out to the constituents that need help with the rental assistance. So we are going to be receiving more of that, and Union Mission will be helping us hand that out. We are also in the process of hiring a human service director. I know the process has been a long one, but we have received resumes and we will begin those interviews probably within the next few weeks. So again, stay tuned, but we are moving forward with the human service director. And sorry, my dog Zoe's barking in the background. So I guess it's time that she wants me to be quiet. Thank you guys. And again, thank you for everything that everyone is doing. And Dr. Fox, as always, I'm anticipating your update today because I know things are not getting any better out there. So thank you for everything that you're doing.
All right, great. Thank you so much, Commissioner. Dr. Carol Fox from Excella Health is next. Dr. Fox, thank you for joining.
Sure. Good morning, everyone. Happy New Year. And again, I'd also like to share my congratulations to Alyssa for her promotion. We're very thrilled that the voices of Westmoreland County will be heard far and wide. So I wish I wasn't here to talk to you today, but unfortunately I am. Just to give you a sense of where we're at right now, across our 3 hospitals, we have 100 patients with COVID-19 who are hospitalized for that reason. In December of 2021, our cases were about 75% of our peak that occurred in December of 2020. And at December of 2020 was our highest month. However, I think it's important to note that our admissions this month, and I realize we're only halfway through, but our admissions this month suggest that it's very likely that January of 2022 will exceed our peak volume in 2020. Our daily positivity rate is about 35%, and that's compared to about 34% in January of 2021, although it's a little lower than what we saw in December of 20. Our mortality rate for this month is about 63% of what we saw last January month to date, and that's probably consistent with the Omicron variant. The Omicron variant appears to be much more transmissible, but for those without compromised immunity, it seems to be a little bit less severe. As has been the case for us, about 24% of all of our positive cases are fully vaccinated. And of those who are hospitalized, 86% are not fully vaccinated, 100% of those on ventilators, and 100% of those who passed away were not fully vaccinated. We do collaborate with colleagues in Allegheny County, and they have indicated, as we look at the Omicron virus in particular, or the Omicron variant, I should say, at the beginning of December, they have told us that in their wastewater assessment, and they do that on a regular basis, about 1% of what was found in the wastewater was noted to be Omicron. By Christmas time, it was about 50%, and for the past week or so, it's been about 90%. So that really tells you how prevalent the Omicron variant is in our region. They also test wastewater in Indiana County, which, as you know, is our neighboring county, and they felt that the progression to that county was a week to 10 days behind that which they were seeing in Allegheny County. So, they would anticipate the peak there to be a little bit behind Allegheny. And of course, we're situated sort of in between those two counties. So I would say that puts us, right around that 5 to 7 day mark. We are projecting in our region a peak in late January, and we're hoping for a precipitous drop off in cases, which has been the experience in South Africa as well as in the United Kingdom. Again, because of the number of individuals infected by the Omicron variant, it would appear that there is some degree of herd protection because it's such a large number of individuals, but time will tell on that. So when we come together next month, hopefully I'll have a little bit more information. Just looking at vaccination rates in Westmoreland County, just shy of 57% of Westmoreland County residents are fully vaccinated, but unfortunately, only 38% of Westmoreland County residents have received a booster dose. And there is a lot of evidence to suggest that that booster dose is really important, particularly for protection with Omicron. And even though individuals who are vaccinated and boosted are experiencing breakthrough infections, for the most part, they're very mild and more cold-like than anything. Some changes for vaccinations. The EUAs have been updated to allow for booster doses of both Pfizer and Moderna at 5 months after your last vaccine in the initial series. They've also approved booster doses for the Pfizer vaccine for kids over the age of 12. And also third doses for immunocompromised children over the age of 5. So that's really good news. And of course, we will continue to work with 211 and with the United Way and others to get homebound individuals vaccinated. And whether that's an initial series or whether that's a booster or a third dose, we're happy to help. And Galaxy is still open. Excella does have a vaccine calculator. If you go to the public website at www.excellahealth.org, and you can click on the vaccine information page, there is a calculator so that you can provide your individual information, what shots you've had or whether you've had any shots, what comorbid conditions you might have, and it'll tell you exactly what you're eligible for and when. So that's been quite a help. In terms of treatment, of course, we're still using medications, in the hospital setting. We do use monoclonal antibodies. There is currently only one monoclonal antibody that really has shown any efficacy against the Omicron variant, and it's in very, very short supply. We are infusing it at our Frick campus, but at this point, we're really only able to provide it to those with the highest number of comorbidities, and in particular, those on immune suppressant medications like chemotherapy or people who are on anti-rejection drugs from transplants, that type of thing. As Commissioner Sorelli Thrasher mentioned, there are some oral agents that are available at some select pharmacies, select retail pharmacies in the area. They're also in very short supply, and they have a fair number of contraindications in terms of, you know, medications that you might be taking that those meds would not work with. So for individuals who are infected with COVID-19, and particularly those with lots of comorbidities, I would encourage them to speak with their primary care physicians. There have been some adjustments, both from the CDC and the Pennsylvania Department of Health, with changes in recommendations for quarantine and isolation practices. There's one set of recommendations for the general public and one set of recommendations for healthcare workers. The healthcare worker recommendations are a little bit more stringent. Obviously, that's because we need to keep our healthcare workers and the patients that they serve safe. So in those individuals, they need to quarantine or isolate for a minimum of 7 days, whereas the general public potentially can be 5 days. There's some caveats there. And again, those are things I would encourage you to talk to your primary care physician about. But, you know, we continue to move forward. As you know, there's constraints across the board, both in staffing as well as in some supply chain issues. It's not the things that we worried about before. We have plenty of personal protective equipment, and of course we have great partnerships with emergency management in the event that we would require that. But it's unusual things like certain types of blood tubes or certain non-COVID medications that are in short supply. So we're continuing to look at that on a regular basis. The one that's probably top of mind, and if you read the Trib today, you would see, is the blood supply. It is fairly significantly truncated. So we would encourage anyone who is able to donate to please do so. And then staffing, of course, is another issue for us. And, you know, we continue to monitor that very closely on a day-to-day basis, but it has led to some backups in our emergency departments, as well as some postponements of some non-urgent procedures. So we're hoping as the numbers, if the numbers rectify themselves a little bit, that we'll be able to improve those areas. But if you have questions, you know, please send them in the chat and I'm happy to answer them. Thanks.
Thank you, Dr. Fox. I do have a question. What is the national vaccination rate right now, or PA? Do you have that available by chance?
I honestly didn't take a look at it recently. I think that in Pennsylvania, and the commissioner might know better than me, but I think in Pennsylvania, it's probably somewhere between 60 and 70%.
Okay.
I would agree with that. I don't know. I thought we were in the low 70s, but it could be in the high 60s. But Pennsylvania as a whole, vaccination rate, it's a lot better than Westmoreland.
Okay, great. Thank you. And thank you so much, Dr. Fox, for such a thorough report. I appreciate everything you and your team are doing, and thank you for taking time to be on the call.
Of course.
Next up is Bud Mertz. Bud, thanks for joining us, and go ahead with your update.
Thank you. You know, the unfortunate part, it's all bad news as far as the case rates go. As we look as of Monday, January 10th, there was 5,573 new cases in January, which surpasses the January 2021 number of 5,370 for the entire month. So, you know, it looks like we're going to come close to quadrupling our COVID cases numbers. I just want to give some reports. We haven't had a lot of dialogue, unfortunately. We haven't heard too much from the Pennsylvania Department of Health. As of Friday, though, I did get a email from the PEMA director that he sent out as far as what the state is looking at. So just to read some of the bullets there is the current focus at the state level is to continue to promote vaccination and boosters for everyone that qualifies, expand the availability of testing, especially in those areas with significant transmission rates and underserved communities, expand the use of the monoclonal antibodies and antivirals as they are approved and become available, provide staffing support to both acute care and long-term care facilities, and work to strategically expand capacity in regional bases throughout the Commonwealth, and to continue to message the public on appropriate utilization of healthcare resources. So that's the latest that we've got from the Department of Health. We've been communicating with our area Department of Health representative, trying to get a testing site in Westmoreland County. As of our last discussion, there was 5 contracted services in the Commonwealth, and I believe only one of those contracted services are in Western Pennsylvania, and they are obviously determining what counties that they're going to offer the testing sites in, based on based on their high rates that's coming in, as well as some of the other indicators. We're on the list. We're trying very hard to get it. Put something in here. If you remember last year, I believe it was in November and December, we were able to secure testing sites up in New Kensington area and down in the Menneson area, and that's what our intention are, if we can get it. But it seems like there's a high demand for them as well. We continue to work with the homebound patients as far as coordinating that effort in between Excella Health, the EMS services, and 211. And we especially, there's been a high call rate has come in based on the boosters availabilities. And so we continue to work with that as well coming in. So the best that I can say is that the Omicron virus is here. It's making people sick. It's affecting staffing. It's even affecting staffing here at our 911 center. We encourage putting in the whatever mitigation tactics that you can as far as avoiding congregate settings, wearing masks, washing the hands, the same as always. No matter if you're fully vaccinated or not, people are still getting sick and it's still affecting your workforce. So we want to make sure that everybody understands that, just because you're fully vaccinated doesn't mean that you need to ignore those mitigation efforts, because you can still get sick. That's the bottom line. Our 911 calls, they seem to have leveled off. Unfortunately, they leveled off at a high rate still. And same with our Zulu calls, which are the calls that come in for an ambulance based on COVID. They have leveled off, but they're they're remaining steady at a high rate. So obviously, it's affecting our EMS dispatch and the availability of EMS entities out on the street. So we continue to monitor that. Yesterday we held a meeting. Tuesday we held a meeting with the EMS directors and continued to communicate with them to make sure that all their unmet needs are met moving forward. That's about all I have here on the public safety side, but we're available for any questions or concerns as usual. Thank you.
Thank you so much, Bud. I appreciate you taking the time today. Next up is Dr. Jason Conway, Executive Director of the Westmoreland Intermediate Union.
All right, good morning, everyone, and Happy New Year. And thanks for the opportunity to present. I apologize, I haven't been able to make some of the previous monthly meetings, but I know this is a valuable resource for everyone on the call and who's going to be listening via the taped version of this. So from the education sector side of things, as we would compare ourselves to last January, I'm happy to report that all of the public schools within Westmoreland County are currently open. And so that's a bright spot here in terms of what's going on currently. Each of our school districts now, without a state mandate on masking, now has the responsibility of determining what their local policies are, and they do kind of vary due to district. We are seeing increases in infections within schools, staff, and students, but not to a level where it's having to cause schools to shut down for any significant amount of time. So I know that the chief school administrators throughout the county are constantly in tune with what those numbers are and so on. One thing that I know impacts the county is the Head Start vaccination requirements that have been laid upon by the federal government, with having those working in Head Start settings and working with Head Start children needing to be vaccinated. I believe the mandate's by January 31st. So as an intermediate unit, we're working through which employees are fully vaccinated and how does that impact programming and caseloads and things like that. So that's something that we're dealing with, as well as I know anyone who's a Head Start provider, they have that on their radars. Pennsylvania did not join any of the lawsuits to block that federal mandate from occurring. So our state is operating moving forward with following that mandate. Any stays that have been identified in the lawsuits do not apply to Pennsylvania, because Pennsylvania was not a plaintiff in any of those court cases. Last but not least, I wanted to share, if you remember, the intermediate unit took on a project countywide, actually statewide, to put together backpacks for students who do become homeless. The intermediate unit still has backpacks. So if you are an organization that serves students who become homeless and you need backpacks or would like to have backpacks available to you, just reach out to me, and we still have backpacks here that we can distribute within the county. So with that, McCray, thank you very much for the opportunity. Welcome to your new position. And Alyssa, we definitely will miss you. So thanks again for the opportunity.
Thank you. Thank you so much. It's great to have you back on the calls. And I did just want to draw attention. Dr. Fox did put information about a COVID testing center on Fry Farm Road in Unity Township in the chat. If folks can see that, there's a phone number for it, and it's scheduled by appointment only. So thank you, Dr. Fox. We also did have a question actually for Dr. Fox. The 57% vaccinated in Westmoreland County is based on what population age? Is it 18 and above or 12 and above? Oh, you're muted, Dr. Fox.
That rate is from the Pennsylvania Department of Health, and that's actually of all citizens in Westmoreland County.
Okay, perfect. Thank you so much. Next up, we have Jennifer Miller from the Westmoreland County Food Bank.
Thank you, McCray. First, I wanted to offer our team's congratulations to Alyssa as well. She knows what she means to the food bank, and we will miss you. But we are very proud of you and your work and what you're going to be doing in the Pittsburgh region. And we know that you'll still keep Westmoreland County right in the forefront. So we appreciate that. Our numbers are going up right now, not drastically, but we are seeing an increase. That's one of our biggest concerns going forward, is what these numbers are going to look like, considering the inflation of everything. The food bank is definitely affected by that. We need more money to provide the same amount of food. So that is very concerning as to how this is all going to work. You know, imported items are much cheaper than domestic items, and you know, you always want to stay domestic first. But with the costs, you know, we may not have choices. So we definitely need to be getting people fed. So that is something that we are very, very concerned about and are keeping track of how that is all working. The SNAP application assistance program is still going strong. We have a lot of people that are still not receiving food stamps and need them now more than ever. So we do have the assistance program here and are able to help consumers get signed up for the SNAP program. 39 out of 40 of our pantries are fully operational at this time. One is unable to distribute, but our team will be going to distribute that on the 20th. So I'm real proud of our staff stepping up, you know, where needed and putting themselves in harm's way in order to make sure that our community is being fed. So we're very also proud of all of the other 39 food pantries that are standing up and taking care of business. So we really appreciate their help. All staff and volunteers and visitors must be masked when visiting any food bank facility at this point in time. That will continue as long as necessary. You know, we understand the value and the protection for not only for ourselves, but for our families and our consumers. So, you know, we are definitely staying strong on that. Thank God, knock on wood, we are not affected staff-wise at this point, and we're hoping it stays that way. Other than that, we don't have a lot to report, but on a non-COVID avenue, the food bank will be celebrating our 40th anniversary during 2022. So, you know, it's not a matter of celebrating hunger, but it's a matter of commemorating the fact that we've been here and we continue to be here and we will always be here. Thank you.
All right, thank you so much, Jennifer, and thank you to you and your team for the work that you're doing. Deb Thakra from Feeding the Spirit is next. Thanks, Deb.
Hi, thank you for allowing us to come and speak for Feeding the Spirit. Alyssa, congratulations to you. You will be missed by us all, but we know you will continue to do good work. Well, like everybody else, we are still going with the flow and trying to keep everybody fed and housed. We see that I just did the yearly statistics for the meals distributed in 2021, and we have distributed 10,793 meals. So when you look at it that way, that's a lot of food. Unfortunately, we still are doing it as a drive-through and a takeout because of COVID precautions, and we cannot gather in large groups. But the other thing we are doing is really trying to connect with all of the people that do come through our distribution line, and we still engage if they need hygiene products, if they need help with a copay, a medical copay, all of those things. We try to really get a handle on how are you? Are you okay? What do you need? Do you need a gas card to get to work? So we've really been blessed to be able to do that. Our volunteers continue to show up every Thursday night, even in these frigid temps, you know. We've had really good support with Seton Hill students. Again, we're very happy about that, and all of the others that come out. As far as shelter, that continues to be an issue. A lot more calls for shelter, you know, emergency shelter, a lot more calls for rental assistance. This year, in 2021, we have placed 665 individuals in temporary shelter. We partnered with Welcome Home, Union Mission, all of the other agencies to make a more permanent solution. But as you know, sometimes there just isn't a permanent solution right now, and I know everybody's getting bombarded. Rental assistance, we're seeing more calls. That really is a big uptick. Especially from Monessen, we're getting a lot of calls. That area, Scottdale, Mount Pleasant, and we've actually had quite a few calls from Allegheny County shelters that are referring domestic violent situations to us, which has been, we've never really run into that too much. Fayette and Allegheny County have been referring to us for emergency shelter, partly because they want to get the people out of the area and into safety. So we've been working hand in hand with Blackburn Center with that, because obviously a lot of times their beds are full. So we want to make sure that we get those folks housed and into hotels safely so no harm is done. Other than that, that's about it for us. We continue to appreciate everything all of you do, and we continue to be grateful for the partnerships. If anybody has any questions for us, just let us know. Thanks.
Thank you so much, Deb. And those are some pretty amazing numbers for 2021. So next up, we have Dan Carney from Union Mission.
Just kind of gonna be like a record on repeat here. I mean, we've kind of heard that housing is, rearing up and needs are present. That's certainly the case. The Emergency Rental Assistance Program, we've distributed or have allocated almost about $7 million in rental assistance to go out. That represents roughly a quarter of what's available. So we have a long way to go in terms of what's available in terms of resources for the community. I think it's important to note that as we kind of move into 2022, we've been working with some providers, 211 and some other folks, to really help take a look at this and how we can get better at delivering. We're going through a marketing campaign that's kind of kicking off here and will strengthen as we go forward, trying to hit, as Deb pointed out, targeted to some of those areas that we recognize needs are being present, and trying to get the word out through social media and other kind of campaigning. Dr. Conway was kind enough to, email information out across the school districts. Jennifer Miller at the food bank has done some distributions for us in the past, and we'll be looking at, again, in the future, getting flyers out to everybody that receives meals. The goal is to get the word out. And, we see a lot of folks that are calling. We do have, under the ERA 2, so there's 2 funding streams that are here, the ability to help those that have had a financial impact during the pandemic. So it doesn't have to be for that second tranche of funds directly or indirectly related to COVID, as does the first ERA 1 program requirements. So I think it's important to let folks know and get them connected. We are working and very excited about our partnership with 211. We're not quite there yet, but they will be able to take calls and do applications over the phone for us. We hope probably within my timeline in there, so 6 weeks, hopefully sooner, but we're working on training up their team and getting everything ready to do that, and hopefully minimize the lag time for folks that need paper assistance, right? Or and kind of having a 24-hour option where they can call and get the hand-over-hand help to apply directly for these programs. So we're very, very excited about that. They're still doing some pre-screening for us, making sure folks are eligible. The Homeowners Assistance Fund is also available. So if you're working with homeowners assistance, that's administered by PHFA. If you type in Homeowners Assistance Fund, PHFA, in your good old Google search bar, the link will come up that you can kind of share out. I can get that out as well. We've seen homeowners that have been kind of struggling, and we've shared that information out with them before. There was an early list. They're just kind of turning the corner on that right now for accepting applications. So the general public will be able to apply for those funds as well. If you're real excited and follow along in the homeless world, our point in time count, some of you I know have participated in the past, where we go out and try to capture folks who are unsheltered on the coldest night always of the year in late January, has been canceled as a precaution, again, of trying to not get groups of people together to go out in response to COVID. So the unsheltered counts and the other things that we do to try to kind of take a litmus test of where we're at in our county will still continue. but that was canceled. And as far as the shelter programs, I know that our housing providers, including Deb, who shared about the work that she's doing, the shelters and the housing authority are all working hard to try to collaborate and fill in needs. What we're seeing really is unique in the sense that we have folks who sometimes are beyond the economic scale of eligibility, but still are struggling. And so trying to find funding sources to help get them through those temporary things. We're seeing folks who are exhausting the maximum allowable assistance through the ERAP program who are hitting their 18-month limit and still not recovered. They can't return to work. They can't because of childcare concerns or health concerns. We're kind of working on problem solving that. The shelter needs certainly continue to be present in terms of emergency shelter. One of the things that we're also excited about with rental assistance, and we're getting set up here on the back end to really fully roll out, is we got some philanthropic support to expedite cases where we know we have families with school-age kids who are struggling. So the eligibility process, it takes about 2 weeks right now to get everybody through the ERAP program and get all their paperwork and documentation and feedback from their landlords, et cetera. And so this will allow us to help move forward in funding in advance of determining ERA eligibility. So it kind of gives us the flexibility to put some stopgap assistance in. And so we'll be rolling that out here later this month as well. It'll operate as part of the ERAP program, but it'll allow us to try to reduce the stress and burden that families are struggling with in our community. And we recognize that almost 70% of our applicants have been families that have had school-age children, mostly single-parent households. And so trying to take a look at that a little bit differently to help move them through. So lots of exciting stuff, but that's it for me.
All right, thank you so much, Jan. Next up is Sarah Stanger, Administrator of Behavioral Health and Developmental Services in Westmoreland County. And Edward, Sarah does have some slides, so if you can move those ahead for her, that would be great.
Morning, everyone. Actually, there was some other information I wanted to try to include while he's getting that ready. I was asked to share, there was a meeting last night in the community it's called Unity in the Community. A bunch of individuals are trying to get together and strengthen our community support. They're going to be celebrating Black History Month and Cardiac Care Month on February 19th from 1 to 6. This is going to be recognizing our Black community leaders and others. They're going to be providing free health screenings, COVID vaccines, and some panel discussions. I'll get a flyer, or I'll get information shared next month on that, but it was just announced last night. We do have new positions that we are trying to continue to support more in the community. We were able to hire another full-time community health advocate, that's Savannah Reynolds, and these are both at Mental Health America. And then we also are trying to strengthen our suicide awareness and follow-up efforts. So we had changed this over to a full-time position, and Kelly Hooker is going to be starting very soon as that Ray of Hope coordinator. We're going to continue to try to expand our efforts in this, doing more outreach, more education, more community education and events. Also, Mental Health America has also we received federal funding to hire community-based care managers, and they have hired one worker, Pam Ackerman, is going to be taking the lead on that, and they do still have another vacant position. Another federal funded program that we are in the midst of hiring for is, sorry, I don't know why that's going off, through RISE, and it's a sister company of WIXI in Greensburg. They are going to be hiring community health workers. So that is still in the works too. So these are all new positions to help strengthen the mental health system. Next slide, please. We still want to try to promote. We're trying to do community outreach to strengthen all of the human services agencies. We are planning they're calling it a Spring Spectacular Community Festival. This is going to be at the fairgrounds on April 2nd. Free community events. There's going to be egg hunts, different. We're going to try to plan for tons of human service providers to be present. We have the whole fairgrounds rented out, so we have tons of space to spread out. So hopefully things cooperate and we can still offer a nice event to get resources out to the community. Next slide. I know the next couple slides is information on this event. If human service agencies want to sign up, this is information on how to do it, how to sponsor it. Next slide. So I just wanted to try to include these if anybody was interested in signing up. I know we've had a lot of interest for individuals to share their agencies. Same, next slide. This is just the information that you would need to do that. And next slide. And the same, next slide, please. Okay, this next event is for the ID side of our office for individuals with developmental disabilities. They are, as of right now, still trying to plan. We try to do yearly a huge event at Westmoreland Mall for resource information, health sharing, information sharing for community awareness. So this is March 12th it's being scheduled for as of now. I just wanted to try to get that flyer. They are still planning information on this, more to come. Next slide. We just scheduled for another free training to the community. This one is going to be on COVID-19 pandemic impact on the young children and families, trauma-informed information. This is a two-part series training, one for clinicians and then one for parents and caregivers and resources available to the community. This is going to be scheduled for May 20th. Next slide. We're also trying to partner with Mental Health America for upcoming trainings. These are going to be starting in February, but we just wanted to get some information out that these are going to be coming. These are all free. Some of them have CEUs attached to them. Again, working with grief, trauma, eating disorders, and anxiety in children and young youth. Next slide. And if you want to try to just, the last I did want to keep continuing to share the community support groups that we're offering. If you want to just try to flip through these, I just wanted to make sure that they were available for the community. Another agency that we are continuing to partner with also is Achieving True Self. They are out in the Norwood area, but we are contracting with them to continue to provide resource and training for community agencies. So if your agency would want to try to bring a trainer in to talk about mental health, autism, IDD, any of these, to try to get more knowledge, more supports, how to understand, this can be a basic level training on up to advanced skills. This is also something free that we're going to be offering to the community. We will be getting more information out. The contract was just signed with them, but they're an amazing agency to work with. So we're trying to steal their trainers to try to provide things for the community. More information will be coming on this, but if you know you want to bring something in for your agency and staff, please just let us know. Thank you. That's all I have.
All right, thank you so much, Sarah. It's a lot of great information, a lot of dates I wrote down. So I think that is it for today. Our next call is scheduled for February 10th. However, you will be receiving a follow-up survey after the call. Please complete it. It's really about whether the calls are useful, you want to continue them, and the frequency with which you want to do them. I know that we had a few months we canceled because the numbers went down, and now we're back at it again. So please fill that out so we can make a decision moving forward. And thanks everybody. Thank you to all the presenters and thank you to all the folks that attended. And I hope you have a great day and stay safe. Bye, Alyssa.
Thanks everyone. Take care.
Thank you, everyone.